Hello and welcome to Pharmacomania. Dr. Shahnaz Malik here, and we are going to discuss pharmacology of alcohol and methanol. On this platform, you will get a 1 minute question daily and a lecture once in a week. What is alcohol? Alcohol is manufactured by fermentation of starch, sugar, and other carbohydrate. The major source of commercial alcohol is molasses, byproduct of sugar industry. So molasses is thick dark brown juice obtained from raw sugar during refining process. Now, what is ethanol? Ethanol is traditionally referred to as alcohol, occupies a place in medicine as well as pharmacology, mainly because of consequences of its misuse or abuse. About 10% of alcohol users are unable to limit their alcohol consumption and become alcohol abuser. Now, types of alcohol beverages. There are major three types: malted liquor, wines and spirits. So malted liquor obtained from fermentation of germinating cereals. Alcohol content is low, 3 to 6%. Examples are beer and stout. When wine is produced by fermentation of natural sugar as present in grapes and other fruits. So wines are different type: light wine, effervescent wines and fortified wines. So light wines is alcohol content of light wine is 9 to 12%. Example are cider. Effervescent wine alcohol content is 12 to 16% in champagne, and fortified wine alcohol content is 16 to 22%. Example port and sherry. Third one is spirit. It is distilled after fermentation. Alcohol content is 40 to 55 percentage, and examples are rum, gin, whiskey, brandy and vodka. Other form of alcohols are like absolute alcohol is 99% weight by weight ethanol. Rectified spirit is 90% weight by weight ethanol. Ethyl alcohol produced by fermented molasses by distillation. Proof spirit is 49.29% weight by weight ethanol. If whiskey is poured on the gunpowder and it ignite and exploded, then it is proof strength. Otherwise, if it is added with water, then gunpowder will not ignite. Methylated spirit is industrial and also called as denatured spirit, and it produced by adding 5 part of wood naphtha into 95 part of rectified spirit, and it is unfit for drinking. Action of alcohol. Local action is like on topical application on skin. It evaporates quickly. It has cooling and refreshing effect and used for the reducing the temperature in fever. Eau de cologne and aftershave lotion are other example of the cosmetic preparation used for their cooling effect. In concentration form, 40 to 50% has rubefacient and mild irritant action. At higher concentration, denatured protein by partial precipitation and dehydration and act as astringent and germicidal action. It also used in concentration of 70% by weight, act as antiseptic and act against vegetative form of organisms spore are resistant to alcohol. And injection subcutaneously cause intense pain and inflammation can occur. Injected around nerve is produced permanent damage to nerve. Now, action of alcohol on central nervous system. Ethanol is considered as dirty drug because it acts on many different receptors in body and can produce wide range of action. It in CNS, it depresses CNS act by enhancing inhibitory GABA A receptor activity and causes hyperpolarization of cell. It inhibits GABA A receptor activity and cause hyperpolarization of the cell. It also binding to inhibitory excitatory NMDA receptor of glutamate to reduce inflow of sodium and calcium ion into the cell and causes decreased depolarization. Ultimately, it depresses the CNS. The lower excitatory effect of glutamate NMDA receptor and enhanced neuronal inhibitory in CNS. Effect like euphoria and pleasure giving activities such as eating, sex and consumption of other substances of abuse like opium and cannabis through central dopaminergic reward system, and craving defined as the conscious desire of drinking alcohol has been linked to dopaminergic, serotonergic and opioid system that mediated the reinforcement. On long-term exposure to alcohol bring about adaptive changes in neuronal system, including downregulation of inhibitory neuronal GABA receptors and upregulation of excitatory glutaminergic receptor, leading to tolerance to many effects of alcohol. Initial CNS effect is due to depression of reticular activating system. Effects of alcohol on CNS is neuronal depressant. Blood alcohol concentration and its clinical effect are like 30 to 100 milligram per deciliter blood concentration. At that concentration, clinical effect will be apparently excitation and euphoria occur. At 100 to 200 milligram per deciliter blood alcohol concentration, impaired motor function, impairment of memory, slurred speech and drowsiness occur. At 200 to 300 milligram per deciliter, emesis and stupor occur. 300 to 400 milligram per deciliter, coma, respiratory and cardiovascular depuration can occur. And more than 500 milligram per deciliter, lethal respiratory failure and death can occur. Cardiovascular effect of alcohol is on small dose produces cutaneous and gastric vasodilatation, skin warm and flushed by depressing vasomotor center, resulting in flushing and feeling warm. And this effect prevent normal cutaneous vasoconstriction on exposure to cold, and it may harmful to take alcohol for warming up in cold weather, as the body would lose more heat. Moderate doses taken in concentrated form like brandy 15 to 20 ml probably stimulate the vital medullary center reflexly by irritating pharyngeal mucosa, causes tachycardia, mild rise in blood pressure and increased cardiac output. When at large doses causes direct myocardial as well as vasomotor depressant and fall in blood pressure. On chronic use of alcohol causes hypotension, cardiomyopathy, arrhythmia and QT prolongation can occur. Effect of alcohol in blood: regular intake of small amount raise high density lipoprotein and decrease low density lipoprotein oxidation. Megaloblastic anemia has been seen in chronic alcoholism due to folate deficiency. Effect of alcohol in body temperature is produce sense of warmth due to cutaneous and gastric vasodilatation. And effect of alcohol in respiration: it causes irritation of buccal and pharyngeal mucosa, causes transient stimulation of respiratory reflexly. But direct action of alcohol on respiratory center is only a depressant. Effect of alcohol on gastrointestinal tract: at low concentration around 10% gives local feeling of warmth and increased salivary secretion, probably by reflex action, and irritant action on the gastric mucosa and increased gastric secretion by releasing histamine and gastrin. When at high concentration above 20% inhibit gastric secretion, and gastrointestinal motility also reduces, causes mucosal irritation or mucosal congestion due to more exposure of alcohol to gastric mucosa, and gastritis, pain, gastric erosion, nausea and vomiting can occur, and on heavy dose pancreatitis may occur. Effect on skeletal muscle. Fatigue is allayed by small doses. Ethanol may cause damage to muscle tissues, weakness, and alcoholic myopathy can occur on chronic alcoholism. Effects on liver. Ethanol causes dose-related toxicity. Common effects are fatty infiltration and hepatomegaly. These results in following changes can occur: impaired gluconeogenesis, glycogen depletion, reduced synthesis of albumin and transferrin, diminished fatty acid oxidation, increased synthesis of very low density lipoprotein. On chronic intake of alcohol causes significant liver damage. By alcohol metabolism, acetaldehyde gets accumulated and damage the functions of liver. It induces inflammation and damage the hepatocyte, causes alcoholic liver cirrhosis. On regular intake, induce microsomal enzyme present in the liver. Acute alcohol ingestion inhibit the hepatic microsomal enzyme CYP450 enzyme system, and on chronic ingestion it induces them, with the resultant increase the rate of metabolism of drugs such as phenobarbital, warfarin and steroids. Effect on kidney. Diuresis is due to decreased tubular reabsorption of water following inhibition of antidiuretic hormone release and increased excretion of calcium and magnesium. Effect on endocrinal system. In acute intoxication is often associated with hypoglycemia and depletion of hepatic glycogen because glyconeogenesis is inhibited and glucose must be given in acute intoxication. Alcohol is aphrodisiac drug and aggressive sexual behavior is due to loss of restraint and inhibition. Performance of sexual act is often impaired, and on chronic use of alcohol can produce impotence, testicular atrophy, gynecomastia and infertility in both men and women. Relaxation of uterine smooth muscle by inhibiting the secretion of oxytocin, but it is not used as the uterine muscle relaxant. Now, pharmacokinetic of ethyl alcohol is being highly lipid soluble and diffusible, is absorbed very rapidly from stomach, duodenum and small intestine. Around 50% within 15 minutes and 100% within 1 to 2 hours it absorbed from GI tract. The absorption is delayed by presence of food in the stomach and metabolized by gastric and hepatic alcohol dehydrogenase enzyme. It distributed throughout the body, water, and is stored in all tissues. It diffuses back into the blood when blood level falls. Volume of distribution is 0.5 to 0.7 liter per kg and crosses blood-brain barrier and placental barrier because it is highly lipid soluble drug. In the lungs, alcohol passes from blood to breath, which smells of alcohol. Ethyl alcohol is metabolized into acetaldehyde in presence of gastric and hepatic alcohol dehydrogenase. And now acetaldehyde is converted into acetate and carbon dioxide plus water in presence of acetaldehyde dehydrogenase enzyme. So these both enzyme, alcohol dehydrogenase and acetaldehyde dehydrogenase, are very important for metabolism of ethyl alcohol. Now, metabolism and excretion of alcohol. Fraction of ethanol is cleared by first pass hepatic metabolism before undergoes regular metabolism. Now, hepatic metabolism of alcohol follows zero order kinetic, that is fixed amount of drug like 8 to 12 ml or 7 to 10 gram of alcohol is metabolized per hour irrespective of its blood concentration. So, it is following zero order kinetic. Excretion of alcohol is through kidney, sweat and lungs. Concentration is exhale air is about 0.05% of blood concentration. This is utilized for medico-legal determination of drunken state using breath analyzer. Now, drug interaction. On chronic consumption of alcohol increase the risk of hepatotoxicity due to paracetamol. This is probably due to increased cytochrome P450 mediated conversion of paracetamol to a reactive hepatotoxic metabolites of paracetamol. All cerebral depressant like hypnotic, sedative, phenothiazine group of neuroleptic and antihistaminic drug can synergize with the ethanol. So this is very dangerous during uh, car driving at the therapy at even the therapeutic doses. Chronic alcoholic are relatively tolerant to general anesthetics like halothane, and disulfiram-like reaction can occur with metronidazole, tinidazole, chlorpropamide, and some of the cephalosporin drug. Alcohol enhance the hypoglycemic effect of insulin and sulfonylureas. Some alcoholic drink like beer, wine contain tyramine which is sufficient to cause hypertensive crisis in patients who are taking monoamide oxidase inhibitor causes increased sympathetic overactivity and causes sympathetic hypertensive crisis can occur. Aspirin and other NSAID causes more gastric bleeding when taken with alcohol. Now, contraindications of alcohol. Alcohol is contraindicated in peptic ulcer and hyperacidity. In epileptic patients, seizures may precipitate, and in severe liver diseases. In pregnant women, because it causes moderate drink can cause fetal alcohol syndrome, resulting in intrauterine growth retardation, low IQ, facial, and other abnormalities can occur. Now, adverse effect of alcohol on moderate drink, nausea, vomiting, flushing, hangover, traffic accident can occur. On acute alcohol intoxication, unawareness, unresponsiveness, stupor, hypotension, gastritis, hypoglycemia, respiratory depression, collapse, coma, and death can occur. Now, treatment of acute toxicity of alcohol. First of all, we have to do gastric lavage. It helpful only when patient is brought soon after ingestion of alcohol. So most patients are disoriented and comatose to maintain patent airway and prevent aspiration of vomiters. So tracheal intubation and positive pressure respiration may be needed if it is markedly depressed. Supportive treatment should be given. So first of all, maintain fluid and electrolyte balance, correction of hypoglycemia because glucose infusion till alcohol is metabolized, thiamine 100 milligram in 500 ml of glucose solution infused IV should be added because thiamine increase the absorption of glucose. Now, treatment of chronic alcoholism. Physical dependence occur, impaired mental and physical performances. Neurological problems are common. Tremors, seizures, psychosis, pellagra, megaloblastic anemia can occur. And alcoholic liver diseases, hypertension, cardiomyopathy, stroke, impotence, acute pancreatitis, infertility, and skeletal myopathy can occur due to chronic alcoholism. Now, withdrawal syndrome, anxiety, sweating, tremor, impairment of sleep, confusion, hallucination, and convulsion can occur. So, treatment is given according to the symptoms of the patient. Benzodiazepine can be given if patient to calm down the patient. Drugs are chlordiazepoxide and diazepam. Naltrexone can be given. It is the opioid receptor antagonist. Acamprostate is weak NMDA receptor antagonist. Ondansetron is 5-HT3 antagonist, and topiramate is anti-emetic drug. So, drug must be given according to the symptom of the patient. Now, clinical uses of alcohol. It used as an antiseptic, rubefacient, and counter-irritant for the sprain and joint pain. Alcoholic sponge to reduce body temperature and fever. As appetite stimulant and carminative can be used. Reflex stimulation in fainting and hysteria, 1 drop in nose, and to treat methanol poisoning. Guidelines for safe drinking. On an average, 1 to 2 drinks per day is usually safe. Do not drive or engage in hazardous activity after drinking. Do not drink if any interacting drug has been taken. safe limit are somewhat lower for women than for men because metabolism of alcohol is lower lower and its bioavailability is higher in women than in men. Thank you for watching the video.